the season, 'tis the season to be sad. That's the way Dr. Hamm, psychologist from West Hartford, started his blog today. 'Tis the season to be sad. Well, does he mean sad or does he mean seasonal affective disorder? I think the latter. Today, we're going to be speaking to Dr. Hamm. He's an expert on all things psychological. And today's topic, as you guessed, seasonal affective disorder. I'm Pat Kazakoff. Stay with me. Hello, Dr. Hamm.
Hi, Pat.
How are you?
I'm doing good. Thank you. How about yourself?
I'm fine, but I don't think I have seasonal affective disorder, but I know that a lot of people do, and 'tis the season, as you said in your blog.
Yes, this blog is certainly timely for the season. Many people, they say upwards to 10 to 20% suffer from at least a mild degree of SAD. And the severe form, 5% of the US population. And SAD is it's an acronym, of course, for seasonal affective disorder. It was identified probably about 30 years ago or so. It's, even though it's not exactly a classifiable mental disorder per se, that is reimbursed by insurance, if you will.
It is reimbursed or it's not reimbursed?
It's not, no. But nonetheless, I mean, many clinicians do see people with this disorder, and it is reimbursable for depression because SAD shows the same symptoms as clinical depression. The only difference.
Yeah, no, I'm listening to you, and I'm listening, and the first thing that pops into my mind, of course, I'm a woman, and I want to know, are the statistics different for women than men?
Yeah, a lot, about 4-to-1 ratio.
Women?
From what I read, that's right. So it's quite prevalent, and it is reimbursable by insurance as clinical depression. It's the same symptoms, the only difference is that SAD is cyclical. It's all contingent on the change of seasons.
So does, when you talk about the change of seasons, does that give the Northern Hemisphere a leg up as far as having seasonal affective disorder?
Yeah, well, an interesting metaphor. I don't know if it's something that is preferable, of course, but yes, the farther you go from the equator, the more likely, more susceptible, the higher percentage of people have this have this disorder. But it also, it happens in the Southern Hemisphere the same way, only for some reason it's a little bit more prevalent in the North, perhaps because it's more diagnosed. Yeah, it is something that is related to exposure to the sun. So the farther we go from the equator, the more susceptible the population is.
So there should be the Northern Hemisphere, that's where we live, and we live in the North. What about the seasons? Is it relatable to spring, summer, winter? What about that?
Yeah, so about 90% of people who get SAD around December. Some people even sooner, as there's more sunlight. Of course, the sun goes closer to the horizon. They're mostly, but there's a small percentage that does, for some reason, tend to get SAD in June. I don't know why that is, frankly. But most people, by and large, get this disorder on a seasonal cyclical basis.
Yeah, no, that sort of makes sense to me.
Mhm.
Unfortunately, it makes a little bit too much sense. What about the people who are affected by it? Are there some people who are more prone to be affected by it?
Yes, that's a good question. So for people who have clinical depression or susceptible to that disorder or bipolar disorder, SAD uh, is more likely to occur because SAD is, as I said, it's an affective disorder, a mood disorder as well. Um, and so if you have a propensity for a mood disorder, you're more likely to also have
So a mood disorder would be like depression or bipolar or schizophrenia. I mean, I'm pulling it out
yeah,
of a hat a bit.
yeah, or schizophrenia, which many people don't realize this, but schizophrenia is predominantly a mood disorder. People with schizophrenia suffer from depression. It's one of the negative symptoms, even though it's mostly known as the so-called split personality and the more florid symptoms. Schizophrenia is identified by, but the most debilitating uh, dimension of schizophrenia is its negative symptoms, the depression. And so, yes, there is a greater susceptibility for people with those disorders, and it's associated with exposure to the sun. So years ago, there was a study that showed that people who are from Ireland are more susceptible to schizophrenia. Now, Ireland is it's a high latitude country. So we might infer from that that perhaps it's more prevalent in that country because it's farther from the sun, and therefore people are more susceptible to the mood aspects that elicits that disorder. And so, with regard to geographical region, the cutoff generally, it's not a strict cutoff, is around in the Northeast, around the state of Virginia, where anything north of there, but generally, uh, the effects of the sun are less intense and do affect less, have a less of a health benefit for us. And therefore, the higher you go, from that point on, you get less benefit, less vitamin D, and maybe a greater susceptibility to this disorder.
So I think this Ireland topic is a topic that we could devote an entire half hour to. But what I'm hearing from you is that I should move south of Virginia, and I should move near the beach. That's what I come to. That's the conclusion I come to. But on a serious note, tell me the symptoms. Tell me the symptoms of a seasonal affective disorder.
Well, as I said, it's the same as a classical clinical or major depression. So one of the symptoms depression is most associated with, of course, is sadness, or what's called melancholy. But depression is much more than that. It's like a syndrome or a collection of different symptoms that come together, including lethargy, a loss of appetite, or in the case of SAD, you're more likely to get an increased appetite, especially craving for carbohydrates and sugars. There's a feeling of hopelessness or pessimism, suicidal ideation, diminished self-esteem, social withdrawal, impaired concentration. And even children, statistics show that about 1 million children here in the United States have SAD. So often, usually SAD is associated with adults, but it also can occur in children. But children, as they do in many other ways, manifest the symptoms differently. So for children who have SAD, you're more likely to see inattentiveness. So if they have ADHD, it's likely to exacerbate that disorder. Or children will get cranky or complain of headaches or stomach aches. And adolescents, you're likely to see a drop in their grades, difficulty getting up in the morning, as well as other classic symptoms of depression.
So I'm seeing that it might be hard to diagnose SAD versus depression or some of the other mental mood disorders, because these are quite general, these kind of symptoms, and they can appear in anybody
Yes, well, that's
at
why,
any time.
that's why whether it's clinical depression or SAD, it has to be the symptoms have to continue over a certain period of time. For SAD, it should be a duration of at least 2 weeks. So you're right. I mean, we all have good days and bad days, and the winter blues. It's a phenomenon that isn't the same as SAD. That some people do get them, and we're affected. Most of us are affected by the sunlight, especially here in Connecticut. We get, although today is a nice day, but we get so few sunny days in the winter. So, that's not the same. That's fairly normal. Many people do put on a few pounds in the wintertime. But if it's something that's sort of continued over an extended period of time, and for SAD, the cutoff is approximately 2 weeks. That's different.
How does the melatonin or serotonin relate to this kind of disease? I mean, I've heard that you need, this when your serotonin is low, you're sad. But how does one relate to that with this kind of disease? I mean, can you really measure your serotonin or your melatonin? Is that a measurable thing in your brain?
Yeah, they do. I mean, there are studies that measure. Frankly, I've never had it done, so I don't know how. I assume blood work, right? That's usually how they do it, because it's in your bloodstream. It's not just in your brain. Yeah, serotonin is affected by sunlight. It's affected by how much vitamin D we have in our system, and it's one of the major culprits associated with major depression. If there's a deficiency of serotonin that's in our bloodstream, and in our, well, it's in our nerve pathways. It's in our nerves. So if the serotonin is not passing through our neural pathways, if there isn't enough of that, then we're more likely to be susceptible to depression. Serotonin is also involved in our sleep-wake cycle, which is regulated by melatonin, the hormone, that substance you can buy at the pharmacy over the counter to help you sleep if you have insomnia. The part of the brain that seems to be involved is called the dorsal raphe nucleus, which regulates our circadian rhythms, and that is.
Oh, you just mentioned something that I have to. I'm very interested. I know I've heard the word circadian rhythms, and circa means around. But what does circadian mean? Circadian rhythms. What? That's a word that's bandied around a lot in non-psychological terms. But what exactly is it?
It's our, all animals, I think. I mean, my pet, I have a cat, and she knows exactly when it's time to eat, when it's time to get brushed. She doesn't rely on a wristwatch, or a smartphone. She just knows. So that's our internal biological clock. And we humans have them too. That's called circadian rhythms. And it's affected by sunlight. Mediated by our hormones, melatonin.
This brings up another point. So when you see people with depression, and you said only about 5% have like severe depression, I've seen that those people, their clocks are off. They sleep during the day, and at night they're up. is that a good example of the circadian rhythm gone bad?
Yeah, and it can go both ways. I mean, people who have phase shift sleep disorder, for example, that's when your circadian rhythms are off. That does make you more susceptible to depression. So it is important to try, if you can, it's not always possible. If you have a regular schedule, it helps to regulate your mood as well. On the other hand, depression, it can influence your biological clock. So people with depression have hypersomnia or insomnia. With SAD, it's often hypersomnia, sleeping too much. And that in itself, of course, is going to throw off your clock. And so, it's a chicken or egg. Depression can cause a phase shift, a sort of a out of whack, so to speak, circadian rhythm, and vice versa.
Now, what about so I guess the most important thing is, how do we treat a SAD or seasonal affective disorder? What's the treatment?
Well, the most obvious treatment is get more sunlight, right?
Mhm.
So, in the summer, that's not so bad if you live along the equator in the tropics. But we don't, of course, take vacations to the tropics. It's one way to help. But unless you're retired, you can't do that too often. So try to get outside as much as you can. Take
What
a
if you
walk.
can't get outdoors? What if you're, you just, and especially with this COVID thing, there was a lot of indoor activity, and, people in nursing homes, you just can't get out. What do you do then?
Right, yeah, many people can't. Well, I was going to say, if you can get out, try to get out at least once a day for at least 15 minutes. And be sure to wear your sunscreen, of course. But if you can't, sit by a window, like I'm doing here. It's great. You can see the outside, sunny day, and enjoy it. And you do get some of those sun's rays indirectly. Or lighten up your home. So make sure that the shades and the blinds are open. You can even paint your walls a bright color. And there today, there has been for many years these light boxes, and they're pretty inexpensive today. I have one I bought on Amazon. It's a small one. You can get the big ones, and it simulates sunlight. It's a 10,000 lux, and you just have that on for maybe 15 minutes, a half hour a day. When you do that, make sure you're not looking directly into it. You have it to the side, but it is facing you, so that you're getting the benefit of those simulated sun rays. So that's one way, getting the sunlight, or substitute.
It sounds quite low tech, what you're talking about. It's not difficult to do.
No, as I say, these light boxes are very inexpensive today. And they're called happy lights by some manufacturers. So that's one way. But beyond that, it's important to continue to exercise. Go to a gym in the winter. It's not as easy. So if you have a gym membership, use it, or get some equipment, gym equipment for your home. Doesn't have to be anything fancy. Or take walks, especially important because that's good for your mood as well as for your health, to exercise, socialize. I think that's why we have the holidays and during the winter months, is to get people together, because that really improves our mood. It's good for our mental health. And watch your diet.
You just reminded me, during this COVID period, we've had this COVID induced state for about 2 years, and obviously socialization was impeded
Right.
by this. So did you see more cognitive affective disorder in your practice? Was that something that was quite obvious, or more depression because of this particular set of circumstances we found ourselves in?
Yeah, I would say, I mean, a lot of depression, a lot of anxiety, uh, because we're going through something we've never scary that was experienced and very isolating for certain. It's children especially affected because they weren't going to school and the grades were affected and behaviors and moods affected all of us, as you know. Um,
What about cognitive behavior therapy?
right. So yeah. So there are other things. I just wanted to just finish talking about the diet. So
It
when we're
was the diet.
diet, yeah, I mean,
Okay.
yeah, because when we have SAD in the winter, we crave carbs, right? We want to eat. So a lot of those Christmas cookies or whatever. So you have to really watch that because as you know, when you load up on sugar, I mean, it feels great, but its effects are short-lived. And so is this phenomenon called sugar blues. Um, so it actually can exacerbate your depression. So it's important to eat healthy fruits and vegetables. Secondly, vitamin D, which is a key vitamin, isn't it? In not only for our health, but also affects our mood. And there is some relationship, as I said, between that and our serotonin levels. Many people have vitamin D deficiencies,
Yes,
especially.
especially women. I know every time you go to the doctor, they do the blood test and they always say, I mean, it's just huge amounts of women where they say you're deficient in vitamin D, but their solution is always to give you a pill or a capsule, which doesn't feel that good. What are your thoughts on that?
Yeah, well, the best way, as I said, is to get sunlight. 15 minutes a day is all you need, especially in the winter. You have to be mindful of that. But yeah, a lot of people do suffer from vitamin D deficiencies, and doctors, physicians do test for it regularly. It's easy to do in your blood work. But you can get it from foods too: salmon, tuna, dairy products, soy. Um, so there are ways you can get it from foods, but many people, I take a supplement every day. Um, and if you have a deficiency, sometimes it can actually give you an injection of high potency vitamin D if it's low enough. So those are the things. Vitamin B12, vitamin B6. Also, they increase your concentration and energy levels. They also can improve your mood. So vitamin supplements and diet. Um, but yeah, there are other options. Cognitive behavior therapy is a lot of research demonstrates depression is associated with negative thoughts, pessimism, low self-esteem. So that can be helpful. Antidepressant medication, um, especially SSRIs, that influence our serotonin levels. But of course, you do have to find a licensed prescriber to do that. Uh, so those are some of the methods. Uh, and
What about the U.S. government? Didn't Marco Rubio recently present the Sunshine Protection Act? Talk about that. How does that fit into this discussion?
took the words right out of
I wonder how that happens.
it. It's all in my blog. It just shows how well prepared you are. um, yeah, so that was very encouraging when that was passed unanimously, easily by the Senate. Unfortunately, well, first of all, the Sunshine Protection Act stabilizes. It's a bill to fix our time schedules. So we're on an oscillating schedule, right? Daylight savings standard. Well, it used to be every 6. Now it's 8 and 4, something like that. And that's very disruptive. Research has shown that the increased uh, frequency of incidences of heart attacks, cardiac events, because it's hard for our circadian rhythms to make those adjustments. And it gives us more sunlight if we just fix at daylight savings. But not everyone's in agreement. Some people would rather fix at standard time. um, it would, so I mean, it would help, I think, the major population if we were fixed and it would.
So that's the concept, that instead of having daylight savings and what's the other one?
Standard time.
Standard time, that we just have one. That's
Right.
the concept. So we're not changing back and forth.
I think it's a great idea. Unfortunately, it's stalled in the House. I'm not sure all the reasons why. The House has its problems right now, doesn't it? But from what I've read, it's gone to the Department of Transportation, where they're conducting supposedly a study to examine the effects on safety and commerce, and that may take up to 2 years. So it's not likely to pass as an act, so to speak, as a law, at least for a while yet, even though it's gone through the Senate. But that would help if we had some standardization.
Well,
most people are not happy with.
I guess that that there's a lot of talk both ways, whether it's important and whether it's not important. I guess that's a debate.
But I think most people are in support of it. Not
Yes.
everyone. Some people, are also would prefer standard time because they get up early in the morning. They don't like to get up into the darkness. There are a couple of states that do it. I mean, Hawaii and Arizona are two states that never went on this oscillating schedule. They are always on standard time.
Well, I guess you just mentioned Hawaii and Arizona. I guess if I said that I was going to move south,
Right,
maybe
right.
I should choose Arizona or Hawaii.
Yeah,
you also mentioned something else, and I want to bring it up. You said that I was well prepared. Well, I want to bring up to the public that Dr. Hamm does write a blog, and all the information that you hear is on the blog, so you can hear it and you can listen to it. But it's very, very well researched, and it has a lot of facts in it, a lot of things that I never knew, and that now I know. A case in point, to move to Arizona or Hawaii, good place to move. And the other thing I want to bring up right now is this is going to be my last show with Psychological Insights. I've been working with Dr. Hamm now with you for 3 years approximately. And I want to say publicly that it has been so edifying, and I've learned so much, and I hope we've taught the public a lot too. Every time you bring up a topic, it's always timely. It's always right on. Just today, we're talking about seasonal affective disorder. What a perfect time to talk about that. So thank you very much, Dr. Hamm, for everything that you do for me personally, but also for the public, for WHCI. It's really been a great trip, and I know that you're going to be on again. I know that our executive director has some very good plans for you with a new person, and I'm also going to be going along to do some other challenges for WHCI. So thank you, Dr. Hamm.
Yeah, thank you. I just want to say also that really appreciated your being on the show, and you've really made it such a professional endeavor. You always are very well prepared, ask very good questions, very organized, and really enhance the program. So really so appreciate you doing this with me, and wish you the best in your future.
New challenges.
New challenges, right? New ventures.
So thank you, and I think right now it's time to say happy holidays to all our friends. WHCI wishes everybody the best of the holidays, and hopefully we're going to see you again next year, 2023. Thank you.